Hello, this is Dr. Gay from First Look MRI, and this is an elderly woman who had pain in the leg. They thought maybe it was a tibial stress fracture or possibly Achilles tendon injury. We did an MRI from the knee all the way down to the ankle, and here I zoomed up on the distal part where we see a finding. The leg muscles look good, and the Achilles tendon coming down here, we see it nice, dark, smooth, and uniform. Had no abnormality of the Achilles tendon, but in front of the Achilles tendon we have a fat pad here. There should be bright fat like in the marrow or in front here, and instead this is infiltrated with inflammation. And this is Kager's fat pad, and when we see this inflammation we call it peritendinitis. So again, the Achilles tendon looks normal. We could see fluid here in the bursa. It's the retrocalcaneal bursa, but we do not see any retrocalcaneal bursitis. That looks good, but we do see this bright area that's inflamed, this fat pad, and so again we call this peritendinitis because the Achilles tendon does not have a tendon sheath, and so it's not called Achilles tendinitis. It's just inflammation around it in this area, so we call it peritendinitis. Now, in addition to this inflammation or inflammatory condition back here, we also see area brightness right here, and this is the sinus tarsi, this scooped out area. Normally this is filled with dark fat on a fat suppressed sequence like this, but this is really bright, so this is diffuse sinus tarsi inflammation as well. And this could cause pain, which is sinus tarsi syndrome. Now, if they have prior injuries, then I'll look at these ligaments to see if they're torn. I hardly ever see that, but you have the talocalcaneal interosseous ligament back here, and then more towards the front you have the cervical ligament that comes up here to the neck, cervical, and it's oriented in this direction, and then more superficial if we come out further. We have the inferior extensor retinaculum here, really superficial, that goes up and around, and all those structures look good. So this is an example of peritendinitis or diffuse inflammation throughout Kager's fat pad and diffuse sinus tarsi inflammation.